KNOW-EMS jointly with the European Civil Protection Mechanism EMTs, dealing with the use of EMTs in domestic operations. We will have two great speakers to talk about their experiences. So without further ado, Michelle, over to you.
Yes, welcome everybody. Before we start with the very, very interesting presentations, I'd like to make a short introduction of our project, the reason why we are here, why we are doing it. Some of you may already know it, but some of you may be new. So can you see my presentation? Perfect.
Yes.
Okay. The project KnowEMS is a consortium with partners from France, from Madrid, Spain and Portugal, Romania, Israel and Germany. And the context of this whole project is another project was already ended, which was named No Fear, which was a network of practitioners for emergency medical systems and critical care. And the main objectives of No Fear was to create a long-lasting community, because during the COVID pandemic, it was very clear that all the people are not connected. And that's the reason why they tried to, or why they created a community. And they indicated priorities for standardization, support quick wins and practical short-term results, and implement a transactional dynamic portal providing fora, a catalog, marketplace, and flexibility to address new threats. And what are we doing now? We try to create a network as well in doing monthly webinars with interesting topics held on the first Thursday of every month. So today's the first Thursday of February. And the past topics, for example, have been EMS organizations from named partners. We have from Germany, we have from Spain, we had it from Israel and all the other countries. And we had a very interesting presentation about the Madrid metro bombings, the management of burn mass incidents, emergency services in mass gathering events, and the last one was on EMS helicopters. And if you're interested in those topics, on the right-hand side, you can see a QR code. All the recordings for today as well will be shared on our YouTube channel. So check it out. And if you don't want to miss anything and aren't already part of our network, please feel welcome to become a part of our KnowEMS network to don't miss any new topics and very interesting webinars. Thank you.
Thank you very much, Michelle. So without further ado, we will go to our first speaker, Directora Adjunta de Operaciones del SAMUR Protección Civil de Madrid. Paloma, did I get it right?
Yeah, perfectly right. Thank you very much.
So first of all, we would like to congratulate an old-time friend for her very justified promotion to her new position. And Paloma, over to you.
Thank you very much. I'm going to share my presentation. Let's see if it works. You can see it?
Not yet.
Oh.
Hold on a second, it's coming.
We can see it now.
Now we can see it.
You can see it? Great. Okay, well, good afternoon to everyone. As I said, I am Paloma Miravet, and I actually work at SAMUR Protección Civil as head of the organization unit. He said it in Spanish, but something like that is head of organization unit. And for me, it's a pleasure to be part of this interesting webinar about the deployment at a domestic health response. And of course, thank you very much for inviting me. As to put ourselves in context of the situation, on October 29, what we call commonly in Spain like DANA, which scientifically is like mesoscale connected complex. But the thing is that it caused heavy rains up to 778 liters per square meter in 1 hour, which means near to 3/4 of tons in 1 square meter in 1 hour. So it was impressive, and you can imagine the water volume and the strength of this water. As this result, some rivers and a canyon overflowed and caused heavy floods in some villages we are going to see. Up to date, 200, no longer showing slides that someone, you see the slides?
We see your first slide, Paloma.
You don't see the second one?
No?
Oh my God. And how do I fix this?
We can see your introduction slide if this is the one you want to show right now.
Okay, but you see this one and this one, okay?
Yeah.
Okay, introduction, okay. Well, up to date, 232 deaths have been reported and huge material losses. So it's one of the worst hydrological disasters here in Spain history. I'm going to put this video, I hope you can see it, about...
Paloma, on my screen, you are still on your first slide.
Oh, really? How can you manage this?
Actually, on mine, you are not. So I can see the video. Probably your internet connection is a little bit poor, Chaim.
Could be.
Try to refresh. Fine.
Yes, this is what I'm doing.
Great.
Please go ahead. I will manage.
I'm going to put a video of a timeline in Shiva, a village of Valencia. So you can see the volume of water they did have. And as the water was falling, some roads and bridges over the river and the canyon collapsed, and several villages were flooded up to 2 meters high. The remaining roads were completely flooded with mud, so it was really difficult to get to the point. I'm not going to give spoilers, but please see this video. So we will later, we'll come back to it and we will talk about it. This is the first days of the flooding, where all the roads were cut and the only one remaining where we could go were like this. Okay, so it was really difficult to get to those places. This is the part where all the orange area is the affected area by the flooding. We have this part, La Torre. It is a part of Valencia capital, and the rest are small villages surrounding Valencia capital. But all the affected area is this one we can see in orange. On October 31st, it was sent a first advanced cardiac life support, as a medical coverage of the firemen of the City Council of Madrid that were going to support there in Valencia. But 2 days after, as Valencia Police Department asked for support to our local police in Madrid, and because they did have security and organization problems because of the roads not practicable, because of security and thieves and everything. So 119 policemen were sent as support staff. We, as SAMUR, went with them initially to support them, to be with them and to take care of them. But the first unit was sent to La Torre, and then the other ones we are going to see now. The problem there is the healthcare centers and medicines were pharmacy were temporarily down. So they didn't have pharmacies, they didn't have healthcare centers because they were all green. But they didn't have like a healthcare problem, just a security problem, but not healthcare problem. So they were temporarily reubicated in other places. As I previously mentioned, the first contingent was deployed at La Torre. They provided coverage support to City Council Fire Department. They help with water evacuation, with logistics, with medical assistance when needed, because they didn't have connection with any other connection center or a dispatch center. They were there, and the neighborhood were asking them for support. So they were what they did found. This first unit was completed 2 days after, due to the request from Valencia local police, and we sent 3 more EALS, 1 BLS, 3 persons of logistics, 1 repair truck, 2 snow shovels, 13 vehicles, and 1 chief medical officer. The fact was that each group of policemen was always accompanied by SAMUR staff and vice versa. When SAMUR staff did have to go to a call, they were going always with our local police of Madrid. What they did, medical issues asked by citizens or found for our units, security issues, we were going with the police, traffic regulation, because there was only 1 bridge left to get to all those villages from Valencia. So it was very complicated to organize the traffic, the food coming, the medicines coming, all the volunteers that were going. They had to fix like tires, lots of them, some technical issues. Of course, they had to find meals to clean the uniforms and everything needed. And in fact, in that first week, there were sent between 4 or 5 stock transfer from here, somewhere Madrid, to Valencia to support with all the things they were finding they didn't have and they needed. So it was really a complicated week, the first week. As you see here, all people going walking, and this was the only bridge left. I have put this map. It's from a city council of one of the villages, Picaña, where they have to reorganize the bus because this bridge and this bridge had collapsed. So they only have 1 bridge, and they have to inform how to get to the other side of the canyon. So it was really very complicated, quite difficult to circulate in those days. The 2nd to 6th contingent, we did have 6 in total, were a little bit different because we managed to get in touch with the command post. In this command post, there was a medical post and a coordination center just for the affected area. So first by phone and then by Tetra, we communicated with them where we were, where our units were, in which village, in which part. And they, from that moment, they dispatched some calls for us, apart from our citizens that were on site and required our intervention, or from our local police. So we have 3 sources of calls, that we can say calls. And in every moment we were in touch with this center, the coordination center, to let them know if we were busy in another call or if they could dispatch us in any other call. So it was quite important. This was people attended in the different contingents. I think it was 6. So these are the blue ones are the calls we found. We were there, no one called us, just come, we have this in this house. And the other ones are the calls that the coordination center sent us. As you see, the first contingent didn't have any call from coordination center because they didn't even get in touch in that week. They were very busy in other issues and we couldn't get in touch at that moment. These are the patients we attended by weeks and we sent to the hospital. It is important to resign that the problem was not healthcare problem because all the hospitals were completely open. They didn't have lack of anything, no personal, no medication, nothing. Just in the local places, they did have problems with the healthcare, with people that couldn't go down, elder people living in high flats that couldn't go down and go to their doctors every day and so on. So there wasn't a healthcare disaster, as we can say. And also the kind of the disaster we have was or people dead or people not hurted, but not was mild thing. So this was really important. Do you remember when I said that I didn't want to talk about spoiler? But it's this one I meant. The most needed unit in every contingent was our repair truck. We have a repair truck every day here at Samur that fix broken cars, fix flat tires, and so on. And due to the floor full of debris, we did have lots of flat tires, up to 50, 60 per day, not only from Samur, but also from local police, our Madrid police, anyone that asked for help, other institutions, other local police, and very important and very demanded and very necessary at that moment was the heavy machinery private cars. So like more than 50 per day, totally unexpected for us. We took the truck thinking we would need it in some occasion just to be prepared, but we didn't expect to have this success with this truck. And I think this is thanks to our planning and ordinary dispositive. And why do we have this truck? Because we know that logistics is important, prevention is important, and training it every day makes that we can do these things abroad when necessary. So it was really good. And another issue was that as the personal housing and street situation was being resolved, the next concern of the citizens was to clean the mud and get the cars. Of course, our car is the second most important thing in our home. So they wanted to get the cars out of the garage. So they used sludge evacuation machines operated by petrol and big cars like we see the red one to take out the cars. And what did this led to monoxide intoxication to several patients. So we had to treat lots of poisonings with carbon monoxide. And again, we must focus. We did focus on our self-protection. And another good thing we did was that each one of us carried a carbon monoxide detector. We usually have it here, but we have one for team. But in this occasion, we had one for person, one personal detector for every time we go to some places like this. If the alarm starts, we go out, and in some cases, we had to evacuate some garage because of this of the dangerous concentration of this gas. So it was good.
Can you repeat the reason for the carbon monoxide intoxication was people trying to warm themselves?
No, people were trying to get out their cars. So they put some machine operated by petrol, and these big cars that were all the time going forward and back, but with no ventilation in the garage. So the concentration of monoxide was really high. In fact, in one of the times I got in, my alarm started at level 3. Level 3 is immediate evacuation, get out of there right now. So I had to evacuate one of the garages where I went. So it was really important. As a lesson learned, regarding to the organization, there were a lot of resources, but not organized at all. There were closed or impassable roads that hindered the rapid logistic of the situation. There was an extraordinary response of the citizens. Maybe you have seen it walking with all the materials and the EMS, but completely uncontrolled and uncoordinated. No one knew how many people were there from this institution, from this other institution. So there wasn't a control management at the beginning, and no coordination between institutions. And regarding to logistic, a good lesson learned is that sometimes you need something you don't even think you're going to need, like our repair truck. So our logistic people had to go searching all around Valencia for the material to repair so many flat tires, because we had, but we have not enough for the quantity we had to do. So maybe sometimes you have to think about the logistics. It's clear that it's needed a supra organization to coordinate everything, because it's a chaos. Prevention, take into account previously some specific places in case this repeats. Continuous communication between the hierarchical levels without duplicating tasks, and do not change guidelines every time. It's better to make few meetings. They have to be efficient. They have to have clear guidelines and clear assigned tasks, because otherwise it's impossible. And as conclusion, the disaster in Valencia has shown the great capacity of citizens, volunteers, and organizations. But at the same time, we have seen that we need greater prevention, foresight, organization, and control. That's very important. And all together with a single command to address and to assess all the organizations they're trying to get in. And this is my presentation from Valencia. Thank you very much.
Paloma, thank you so much for a wonderful presentation. First of all, colleagues, in the QA function, please put your questions, and I will ask a provocative question. I'm sure you were prepared for that, Paloma. We saw on the media a lot of anger from the citizens against the authorities.
Mm-hmm.
Was that a problem for you?
Not really for us. We didn't have problem otherwise than managing how to get there. But it's true that I don't know if you know, but the community of Valencia is run by a political team, and Spain is run by another political team. So it's very easy that one blames each other and each other blames one. So there are being mistakes, for every part, I think. It's my personal opinion. From the alert to the prevention to the... But I have to say also, in discharge of them, that I don't have to discharge them from anything, that the DANA is very common in Valencia, in Alicante. In almost all the years, we have 3-4 DANAs, and they put the red alarm, the red alert, it's going to come a DANA, but nothing happens until it happens. So they did have a red alarm, but people were so used to have, but no one could imagine this quantity of water was going to come. So it's been a compound of many things that made the disaster greater: political, situational, cultural, and many factors.
Yeah, but for me, it's very interesting that the public did not direct their anger towards you, even though you represent the authorities.
No, on the
a way.
contrary, everyone that was going there, they knew we were going to help. And on the other side, all the time, thank you very much for coming. They were eager to talk, to tell us how difficult it had been, how bad it was made, how alone they had felt. But once we get, it was all greetings and thankful, and so it was very pleasant for us to help there and be part of them. Yeah.
Another question, and that would be my last one, would be how, knowing your volunteers and staff in Madrid, I'm sure they were queuing in the headquarters to be deployed.
Yeah.
How did you manage those whom you did not deploy?
Well, from the first moment, we had a huge list of workers and volunteers that wanted to go. So we had to make a first selection. This selection was made. The first list was made from people who participate in the EMT, not for nothing, but because they are vaccinated of everything. So in case something, bacteria or something like that happened, they were vaccinated, and we didn't have to worry about if this one is vaccinated, if this one have the smallpox or whatever, you know. So we made this first selection. And then we were asking some people that week couldn't go, they go another, and there were others that couldn't go because there was 6 contingents, no more. So they will remain for the next one. Let's hope many years forward.
Thank you very much, Paloma.
Thank you.
Julian, over to you.
Thank you very much, and good evening, everyone. I'm gonna share my slides, and hopefully you can see them now.
Yeah.
Perfect. Some words about myself. When we had the flooding in Germany in 2021, as some of you probably might know, the civil protection system in Germany is organized by NGOs and ruled on a local federal level. So that just to keep in mind during my presentation, there are many actors in the German civil protection system who are not managing each other, but who are on the same level. So this will probably explain some information later. When it came to the flooding, I was, as a volunteer, a deputy platoon leader into civil protection units from Cologne, which those I were deployed to the Ahrweiler flooding. First, initially with a emergency shelter unit for about 3 days. And the second time for, I'm not sure, I think 16 hours with a fire brigade platoon from Cologne. And during this time, I was already a volunteer member of our EMT, which responsibility I took over later. So much about my person. Regarding the flooding, we had a larger weather situation, not only over Germany, but also over the states nearby. And the center of this heavy rainfall was especially in the Ahrweiler region, by which we had much more rainfall than for many years, which means that the population which was living in those villages and cities next to the rivers, which were flooded later, weren't probably aware of the risk coming with these rivers. Anyway, after the end of the Cold War, many warning systems like sirens have been removed or weren't in use anymore. So by this, we got on the first hand problems with the alert of the population, and on the other hand, we had problems with the coordination of this emergency. But about the impact first, unfortunately, we have lost in total 220 lives, thereof 188 in Germany. Many people were affected and more than 1,000 people were wounded. Beside of that, of course, infrastructure was damaged. And in this point, I would like to mention that especially the cellular network as well as the Tetra radio network has been damaged. So even those civil protection units who were deployed to the mission area were not really able to communicate. That's one point. The more problematic point is that it was the same for the management units who should have been on top of this of those deployed units. That means, for example, with the fire brigade unit, when we were deployed, our command car had the only task to drive around with a satellite phone to get all those command stuffs around our deployment area connected to the federal level. About the medical situation during this floodings, we had on one topic the evacuation of a hospital. So whole hospital wasn't out of charge at this moment. We, of course, had several injured people who had to be treated, especially after the flooding itself, but during the recovery phase, while tidying up the houses, the streets, of course, people got injured and they had to be treated. For this, to deal with this emergency from all over Germany, especially from the cities and states around, many civil protection units has been deployed. Thereof, as I already mentioned, in Germany, so-called Betreuungsplatz, emergency shelter units for example, 200 or 500 and more people. And as I mentioned already, my first deployment was with an emergency shelter unit for 500 affected people, with which we were treating about 1,200 people. And those units are usually designed to last about 48 hours without support. As I already mentioned in the introduction, we have been deployed with this unit about 3 days. So we had a severe leak of staff and of equipment. And this is the point where an EMT would come. So an EMT would bring, of course, it wouldn't be so fast like all regular civil protection units. That means a regular civil protection unit usually needs up to 1 hour before it is ready for deployment. And an EMT, for those of you who are familiar with the EMT system, needs at least 48 hours to be ready for deployment. But as you can see, this is would have been a perfect match to get a link between the short-term reaction and the long-term reaction to such a situation. An EMT doesn't stay for only 48 hours, but for at least 2 to 4 weeks. And this was really a problem for the national civil protection units, which had to be exchanged latest after 48 hours, which was sometimes possible, sometimes not. And as already mentioned, an EMT brings lots of high experienced and highly motivated staff and is absolutely self-sufficient. So a national civil protection unit usually needs drinkable water, needs some food, especially for the affected population, needs probably shelter to keep their own stuff. And those are all things who are brought by an EMT on a regular basis, especially talking about radio communication. I mean, our EMT usually goes on mission with at least 4 to 5 satellite phones. In the scenario when we were deployed with a fire brigade unit, there were only 1 satellite phone in the whole region for several command staffs. So those are all huge benefits of an EMT being deployed, doesn't matter internationally or in their own country. And why the question why the German EMTs haven't been deployed, especially looking at the European map and seeing that Germany is hosting 1/4 of all European EMT type 1, and none of those EMTs has been deployed. And my probably explanations about that would be, on one hand, very simple leak of knowledge about EMTs and the international system. As mentioned in the beginning, the German civil protection system is ruled on a local level. So it isn't sufficient that the national level knows about the EMT system, but in every city, in every dispatch center, the leadership staff has to know about the system to think about bring such units on mission. So I think not politics were the largest problem, but knowledge about there could have been help. But if I don't know who to alarm, who to order, I can't order any support. So we are working on this to get, and that's why we are this evening here, and to get the knowledge about EMTs spread. And as you can see in many disasters, often the political question is a problem, that the government or even the local government doesn't want to appear as weak, as they need help, and that always brings the population into an unfortunately situation to suffer from problems which usually could be solved. What we learned from this disaster, and there were even some books written about that, there is a lack of standardized management, especially on the local level, and I think we can't be angry even about the local management stuff, because in small cities or small villages, there won't be any awareness about training command staff and dealing with such huge situations. And so this is one point. There has to be a better training for the command staff on the governmental level. There was critical lack of satellite communication equipment. And there has to be a better knowledge about civil protection systems. So this was a short walk through this disaster from my side. Are there any questions?
Chaim, you are muted. Sorry.
Sorry. Julian, thank you for a wonderful presentation. And I think that you are pointing out to a very relevant point, which is that in our own houses, there is a clear division between domestic operations and international operations. And often the domestic people don't know about international don't know about domestic. And I think that this is a challenge everywhere. But and my question is related to that, because one of the concerns that I often hear when it comes to the deployment of the EMTs as such is that there are two concerns, and I will address them both, and I will ask you to relate to that. One is regarding personnel. If you deploy your EMT, the personnel that you are deploying is the same that you have for your regular operations. Often organizations don't have additional personnel. So they were there for 48 hours working under civil protection. They went home, had a shower, had something to eat, changed uniform, and are coming back as an EMT. So that's challenge number one. And challenge number two is with regards to the financial implications of the deployment of an EMT, because when you deploy for a month, that's a totally different story than being there for 48 hours.
Thank you for these two wonderful questions. Regarding the first question, as an EMT is a highly specialized team, we need also highly professionalized staff. That means that we recruit our staff on one hand all over the German Republic, and on the other hand, we also have team members from Austria, Finland. So by this, yes, of course, some of our staff members, some members of our staff roster, of course, as I myself was, has been deployed with national units. but most of the stuff, pretty sure, would have been available for such a mission. And if there's for example, one unit, only one team member missing, and German civil protection units usually should be staffed at least twice, that should not have been such a problem. So I hope that answers your question, your first question. And regarding the second question, and the further development of this disaster response, units have been developed, especially medical units, which were kind of small teams moving day to day from village to village and offering medical service, which were paid by the government, basically. And those units were basically doing exact the same job an EMT Type 1 mobile would have done. And of course, for long-term treatment, this would have been an option. But for mid-term, the same job could have been done by an EMT Type 1 without bothering the local system for transportation, for water purification, for staff, and so on. And regarding the costs also, if the region or Germany would have activated the European Civil Protection Mechanism, all of you are knowing that many costs will be covered by the system. So if we are thinking really about a cost, that shouldn't be a problem at all.
Thank you. Colleagues, this is your opportunity to ask questions, make comments. I open the floor. Please put your questions in the Q&A function. We'll be more than happy to hear you. So, Michelle, please, over to you.
There's indeed a question in the chat.
I'm not looking at the chat. I'm in the Q&A.
The question if whether we would wait for acceptance of our offer from the lemur. And yes, as part of the German civil protection system, we of course can't bring ourselves into a mission without any permission. Things like that would directly guide into chaos and wouldn't help anyone.
For both of you, the question is, what do you think will be needed to be better prepared for climate change related disasters? I think Dana was a good example of that, and your flooding. What do you think we will need more or different to adapt better to climate change?
In my part, I have to say, if you remember the map I put, you see Valencia, capital, is separated by a bridge. And many years ago, they modified the way of the river Turia because there had been already a big flooding like 50 years ago, something like that. So never again Valencia was flooded. So I think we have to be prepared and to know that this is going to happen unless we reorganize the places where we put houses, the places where the river goes, or something like that. So it's important, the prevention and the situation like it is right now.
Julian.
I think one of the most important things is that we as Europe or even as the world will have to collaborate more. We have to work together in disaster response. As we already are doing this with the EMT initiative or with the European Civil Protection Mechanism, but we really have to strengthen such systems. We're talking about sometimes high impact, low probability scenarios. And for such scenarios, we need expensive, highly qualified disaster response units. And we can't have such units all over the countries many times, just to financial reasons and later to staffing reasons. And by that simple problem, we have to collaborate.
Thank you very much. Michelle.
Thank you, Julian and Paloma, for your very, very interesting presentations. And thank the audience for the questions. I've already put it in the chat. If anybody wants to receive a certificate of attendance, just click on the link or scan the QR code and register yourself there, and then you will automatically receive one. And as I said in the beginning, we have our webinars on every first Thursday of each month. So for the March webinar, the topic will be the different approaches to strokes and pre-hospital care. So don't miss that topic. And so you don't miss it, maybe follow us on LinkedIn, stay tuned on our YouTube channel, and thank you for having us today.